Should we introduce ourselves?
Yeah.
So we'll introduce ourselves while we just get the right slides up. So I'm Lorraine Wolfenden, Leadership Support Manager in the Patient Experience Team at NHS England and NHS Improvement.
Hello, my name's Helen Lee. I work in the same team as Lorraine at NHS England and NHS Improvement, and we lead on the Always event programme, which we'll be talking a little bit about, and our co-creation journey.
And hi, my name's Lisa Ramsey. I am Service User Voice Policy Manager for the Maternity Transformation Programme team at NHS England and NHS Improvement.
So how did we come together? Well, the work that we lead on, Helen and I, that we're going to talk about in a minute, which is a quality improvement methodology to improve the experience of care of people using different care settings, hospitals, community hospitals, etc. And one of the gaps that the people that we work with felt they had was around co-creation. Some are doing it already, some it was an entirely new concept, so we felt that we wanted to upskill people. So we were looking for something, a course or something to do that, and someone in our team had seen something on Twitter from Gemma and Paul, and we thought, maybe that's the thing that we can use. So we then had a conversation with them, who put us in touch with Lisa, and here we are. We've worked together to co-create something that's worked really well. And there we have the right slides.
So Gemma talked about it this morning. Co-production is the word that's very often used in NHS and in England. And it's not, as Gemma said, it's not a new concept. It's something that's been around for a number of years. And there was actually a co-production model that was produced in partnership, and probably about 4 or 5 years ago now, by the Centre for Collaborative Care and NHS England, which talked about the values and steps for co-production. So it's not a new concept. It's also in something called the NHS Mandate, which is what is set out by the Department of Health and has key deliverables. And in there is a specific target that states that by 2020, there's a question on the staff survey that goes out to NHS staff around the percent, asking staff, do you use feedback? Is feedback used to inform improvements in your organisation? And there is a direct mandate in there that says, as an organisation, the NHS needs to get better at listening to what people are saying about their services, and with them improve services.
Yeah, so Always events started within NHS England at the time, back in 2015. And it was around the time that, I don't know if people are aware of Kate Granger, the consultant who sadly passed away from cancer at a very young age. And she had launched her Hello, My Name Is campaign. And the patient experience team at that time thought that was a fantastic concept and something that should always happen for people when they're interacting with healthcare professionals, but wanted to take it a little bit further and came across the Always events methodology. And the aspiration was not just to deliver a programme of work, but actually to create a social movement and make sure that the critical mass of engaged healthcare organisations was reached. Then word would spread beyond that direct communication between NHS England and those organisations. And people who hadn't signed up to the programme would hear about it and think, we want to be part of that. And that was the aspiration back in 2015. And I'm pleased to say that that's the position we're in now. We have people contacting us that have heard about co-creation and Always events and absolutely want to be part of that work. So what do we mean by an Always event? People often think that it's the opposite. You might have heard, if you live in the world of the NHS, you might have heard of never events, which are serious, untoward incidences that should absolutely never happen, such as amputating the wrong limb, etc. People think, it's just the opposite. It's absolutely not the opposite. The difference is that an Always event is about what's important to the people that use those services, not decided by healthcare professionals or clinicians. It's about what's really important to people using those services. The official definition is Always events are defined as those aspects of the patient and family experience that should always occur when patients interact with healthcare professionals and the delivery system. Now, it's trademarked to the Institute for Healthcare Improvement, who took on the work from PICA America some years ago. So that we stuck with the terminology, but if they were to start the work now, they would actually call it an always experience. The always a bit is the thing that should always happen. So there's 4 criteria for an always event to actually be an always event. It's got to be important, but not important to us as healthcare professionals, absolutely important to the people that really matter, the people that use those services, patients, their families, carers, anybody that's got a relationship with that person, it's got to be important to them and co-created together to decide what will work. Evidence-based, so you wouldn't do anything that didn't improve the experience of care. You gather your evidence as you go along through that journey. Measurable, in the world of quality improvement, everything's got to be able to be measured. So you've got to know that you've absolutely made a difference to the experience of care of those people. So using simple measures, which we haven't got time to talk about today, you will demonstrate that you've actually made a difference and improved that experience, and affordable. And I think the beauty about always events and the reason it's been so successful is that it doesn't take lots of investment. It's about the relational aspects of care, little things but I've got that are really important to people that use those services, and working together to improve that experience. Traditionally, I'm a nurse by background. Healthcare professionals, doctors, nurses knew best. And were taught that, you did things to your patients, you told them what you were going to do, what the process was, what the outcomes would be, and you did it. They didn't have a voice, they didn't have a say. Then there was a shift towards doing for, and absolutely now there's a real culture shift towards doing things with patients, and that's where the co-creation bit comes in. So we ask the organisations that we work with to really consider at an organisational level, whereabouts are you in that journey? Often people are somewhere between doing for and doing with. We want to get to the place where everybody absolutely does things with people using services. So that is, I'm not going to go through all that, but that is the framework for the Always event. So that's based on the Institute for Healthcare Improvement's model for improvement. So using PDSA cycle, which you may or may not be familiar with, but we've not got time to talk through that. But there's lots of information on the website, which I think is on one of the slides. We're around all day. If you want to know more, come and talk to us and we will explain in a bit more detail, but we could stand here all day and tell you all about the methodology. But unfortunately, that's not what today's about. Okay.
So over the last 4 years, there's been lots of learning from working with people and understanding some of the challenges and some of the joys of working in this co-creative way. And one of the things that has come up as a recurrent theme has been around people having the confidence to step into that space. And for some, as Lorraine explained, for some people it's a very different way of working to invite people in and to hold that space and hold those conversations. So that was something that came up as a recurrent theme. So we were really curious, is there a way that we could support and enable people to have the confidence to step into that space? And that's where we connected with Gemma and Paul and with Lisa, and Lisa had done the 4-day programme. So we were really interested in seeing if there was something that we could create that was a kind of a bit of an introduction, and that's where the 1-day programme came from that we developed, which had at the beginning had a pre-course webinar and was followed up by a sustainability webinar that we only had last week, so it's fresh off the press, the findings from that.
So hi, my world is maternity. So I'm going to be really selfish and just ask maternity people to put their hands up because I'm so pleased with so many of you here. Thank you. Really, having done the course, what I wanted to make sure was that these 100+ maternity voice partnerships that we've got all across England really grasp this concept of co-creation. So these are local teams made up of people who use maternity services, so mums, dads, along with the people who provide maternity services, so midwives, obstetricians, and really importantly, the people who commission them, the people who hold the purse strings. And the idea is that these small local groups work together to co-review and co-design maternity services. But there was a bit of a gap in terms of how that happened. And so it was really exciting for me to be able to bring that learning that I had gathered doing the Co-Creating Welfare course back to my maternity world. So the map on the left shows the maternity voice partnerships that we've got set up already. And we also have all of them networked by National Maternity Voices who have a stand at the back.
So one of the things that I had taken away from, one of many things I'd taken away from doing the 4-day course, was the idea that co-creation is possible even if you're not all in the same room. And I started playing around with this concept of using webinars. And in my experience, the only sort of webinar I had been on was sort of an hour long. You log on, you watch and listen to somebody present, and then you ask a few questions. And so we started to have a go at doing a webinar with a blank PowerPoint presentation and somebody facilitating completing that, populating those slides during the webinar. So when we got together with Gemma and Paul and thought about how can we take the co-creation learning wider to the Always Events people out in the system doing co-creation and to the Maternity Voice partnerships out in the system doing co-creation. And we started with 2 webinars, and we had a couple of slides that were ready to go, and then we had lots of blank slides. And one of the first things we asked people to do in advance of the webinar was give us their ideas of what the challenges were for them already doing co-creation. So this is a word cloud that we started the webinar with. We also asked them what were their successes. Some people were already doing it, so tell us what works, what's the benefit, what's the success when you do co-creation. And that was the word cloud we had from that. And then these are the slides that we populated together on the webinar, co-creating at the same time. So I won't go through it all, but we managed to talk together and come up with a list of what co-creation is not. And it's really interesting, when you define what something isn't, it really makes defining what something is so much easier. So it was really interesting going through this. Well, what is it not? Once we've defined that, then we can move on and do what is it. And of course, we've got this huge list of what co-creation is, which is interesting listening to Gemma talk this morning about actually we've all got different experiences and lived experience that we bring to the table when we're doing co-creation. And that was illustrated when we did this together on the webinars. Shall I hand over?
So after we'd done the pre-course webinar, we then had 2 collective gatherings. One was in London and one was in Manchester. And there's a few people in the room who I can see who were with us on that day. So if you want to have a chat to them. And basically, it gave an opportunity to bring together people as Lisa said, who were working in Always Events and in the local maternity voice partnerships, and giving them an opportunity to network, but also to share some of the fabulous tools and practical tips that Gemma took us through this morning. And you can see some of our wonderful creative Lego up there. And it took us through, on those days we went through some of the tools, and I'll not go through them all, but they very much were the tools that we talked about. We used the cube, we used the walk, we co-created our rules for engagement. You can see up there some of the posters. So a really interactive day, and in total there were about 60 people who attended those two days. That's a picture there of our rules of engagement with our post-it notes and some of our Lego from the London event. And last week we held our sustainability webinar. So we brought back together those 60 people on a webinar using the model that Lisa talked about, kind of having some slides, but very much we co-created it on the day. And we asked people to give their reflections on the day. And up here there's 4 main themes that came out, that people found it was really powerful to have the opportunity to network and talk to people about the challenges and successes and learn from each other, working in those different fields. Something about the fact that it was, and we're all going to get the opportunity to experience this today, it was a real practical, get stuck in there, some real tools that we could take back and use the next day, really. It was great fun, which was great. There was lots of laughter in the room. And it was a real mindset shift, that it was really about kind of, and what somebody actually said, that they had shifted in their mind about their approach to co-creation, and that they actually were facilitating co-creation rather than being solely responsible and have that burden of making that happen. And we've got Sandra in the room who has gone out and used some of those tools. So she's used the cube to have conversations with midwifery students about and have women who've experienced the service talking about and have very different conversations from using the cube. And Sandra, if you want to give a wave, if anybody wants to talk to Sandra, she's sat in the middle there. And people have used the co-creation tools, and that was the great thing to hear, that they'd gone away from those co-creation days, and 6 weeks later were able to tell us how they'd changed the way they practically worked. They were having walking meetings and walking one-to-ones. They were using the story cube. Somebody said they'd used it to plan their family holiday and get people in the family to talk about, you know, what mattered to them about their family holiday. That people were taking really creative approaches now to team away days, and they've been really inspired by the co-creation tools to go out and invite people to join the conversations. And we asked people how had their practice changed as a result of coming on the course, and you can see up there some of the things that people were practically putting in place, the meetings. And that people felt that the course had given them, it kind of liberated them. They felt that it was, you know, it's okay to co-create. We can go out there and we can do it, and we can step into that space. And lots of ideas about taking it to the next level. And somebody said, could we have the cube as a virtual online so that we could populate a cube in a webinar? That would be great if we could do something like that. So people were really really embracing the tools and have practically used them, and we're using those to kind of go forward and take them to the next step and invite people to the next meetings. And as a group, people wanted to stay connected, so that group of co-creations are going to stay connected, and we're looking at how to do that and how to facilitate that and how they can continue to share their co-creation journeys. And from that course, what Lisa and I were, Lorraine was on holiday, we're at one of our directorates of nursing away days. I'm new to the directorate at NHS England and Improvement. It's recently come together. And we were just having a conversation about how excited we were around the co-creation. And we thought, well, what can we do? How can we feed this back really to the wider directorate at NHS England and NHS Improvement? And we were having a conversation and turned round and shared it with our director, Neil Churchill, who then thought it was an absolutely fabulous idea, scurried off and unbeknown to us, had a conversation with Ruth May, the chief nurse for England, and next thing, it's been announced by Ruth that we're going to be facilitating co-creation for the whole of the directorate going forward. So we're taking that so that we hopefully can be role modelling that at NHS England and NHS Improvement and be sharing with others the co-creation philosophy and doing that together. If anybody's interested about Always events, there's loads of information. Come and find us in the day. And if you're interested in the maternity work, then Lisa and some of the maternity colleagues are here. But we're really looking forward to spending the day and sharing and co-creating with you. So thank you.
Thank you.